Hello, Dr. Dilip Gude here, physician, Somajigoda Yashoda Hospital. We'll discuss about liver diseases in general, like what all are the factors that affect one's liver. So we all know how alcohol affects liver. In fact, it is if alcohol is not taken in moderation, liver is the first organ to get affected, and over a period of time, there is alcoholic liver disease that keeps progressing, and it may actually turn to become chronic liver disease and then even cirrhosis, and in some patients it can actually become hepatocellular carcinoma, that is nothing but liver cancer. So alcohol is one very important and very common cause for causing chronic liver disease. So if someone who takes more than say 120 to 160 grams of alcohol, say over a period of more than 1 to 2 years, then there is bound to be alcoholic liver disease. In some patients, it may actually go on to develop chronic liver disease. So we know that 80% of liver injury is something liver can sustain, as in it can repair itself. But once you push that limit, once you cross that and continue to keep drinking, probably, then liver loses its capacity to regenerate, and then chronic liver disease starts, and which will then progress to become cirrhosis of liver, and then probably it may also become hepatocellular carcinoma. So apart from alcohol, what are the other factors that can cause liver disease? So basically, outdated tetracyclines, these are one of the classes of antibiotic drugs. So there are so many drugs. In fact, paracetamol, a simple paracetamol, if taken in more than the recommended dose, can definitely trigger hepatitis, and in some patients it can cause acute fulminant hepatic failure. So that is something within a few days the liver starts becoming so injured that you cannot reverse it. So that is something, fulminant hepatitis is something which can be caused by drugs, by virus like hepatitis B, hepatitis C, or a background alcoholic liver disease, or infections. Like for example, even malaria can push somebody into a fulminant hepatitis. So in these cases, we don't really have much time. We may need liver replacement methodologies like Prometheus, and there are some liver dialysis techniques basically, which can buy you some time before you decide for liver transplantation. So if you look at other causes, mainly hepatitis B and hepatitis C are chronic liver disease conditions where, as we all know, there is no cure for hepatitis B or hepatitis C. Once you get it, you can only control it. So one needs to understand if there is hepatitis B, then we need to know the viral load, and we need to know if there is hepatitis B E antigen positive or not. So once you know the viral load, then if it is say 1,000 or more, you will probably need to start an anti-hepatitis B medicine. Entecavir is the most commonly used anti-hepatitis B medicine. It can help you bring down the hepatitis B viral load. Similarly, hepatitis C is something which is, again, there is no cure for it. We can only control it, and we need to do a genotype testing. We need to know if it is 1, then 2, 3, or 4. So particular genotypes respond to particular therapies. So knowing that can help one bring down the hepatitis C viral load as well. So alcohol, then hepatitis B and hepatitis C, drugs like outdated tetracyclines, then even high dose paracetamol, or infections like malaria, for example. All these can push somebody into hepatitis. And one very important but underrated and under-focused problem is non-alcoholic steatohepatitis. This is nothing but fatty liver that we all see. It can actually progress to become NASH, NASH. That is nothing but non-alcoholic steatohepatitis. So when NAFLD, that is non-alcoholic fatty liver disease, is not being addressed in time, when people tend to accumulate more and more fat into the liver, then this condition develops, that is NASH. Of course, even that is to some degree reversible. When you remove the offending factor, when you help patients and decrease their body fat and decrease their liver fat, definitely you can probably improve the NASH and reverse it. But if NASH is continued, then they can definitely go on to develop a chronic liver disease, or in some patients even cirrhosis. So definitely, apart from alcoholic liver disease and fatty liver, there are other causes like hepatitis B, C, malaria, and drugs that can push one into chronic liver disease or cirrhosis. So liver diseases are something which are we all need to be wary about. We need to understand, and the moment you start looking at this SGPT, SGOT levels starting to rise. Say for example, normal levels are 30 and 40. But if you see them to start going up to 70, then 80, then 100, 120, 3-4 times, then you probably need to visit your hepatologist or physician and then discuss what you can do to bring down those levels. And of course, GGT, the gamma glutamyl transferase, is a test that will reflect the underlying alcohol-related liver damage, and that can help you, how much you need to cut down and moderate your alcohol intake as well. Thank you.